Heart disease comes in many forms, but its impacts are felt across genders, races, and ethnic groups. In fact, one person dies from heart disease every 34 seconds in this country. But today, we want to shine the light on how heart disease affects women who have a particular set of risks and poorer outcomes that are often not recognized. Welcome to Healthy Communities, a look at health challenges and the people working to provide solutions.
One of the biggest challenges in heart health for women is this underappreciation about how prevalent it is, what's really unique about women compared to men, and how they act on that information. There are common risk factors that are the same across all individuals, but in women there is a separate set of risk factors, and those are actually related to the reproductive journey. Some of those things include a form of high blood pressure that happens in pregnancy called preeclampsia, early menopause that occurs before the age of 40, or a hormonal imbalance that's called PCOS or polycystic ovarian syndrome. Also, cardiovascular disease in women starts accelerating as we get into menopause.
As a healthcare system, we have this one-size-fits-all approach, as if everybody needs the same thing, which really isn't true.
There are also differences in terms of what the physiology of our hearts look like. Female hearts tend to be smaller. Our blood vessels tend to be more narrow.
With a heart attack, women may feel fatigued, a little nausea. They may not have that classic chest pain radiating to the left arm. When a woman has a heart attack, they're actually more likely to die from that heart attack. And we not only see disparities when it comes to women's health, we see disparities among different groups of women. A Black woman is actually more likely to have high blood pressure than a white woman, but they're less likely to have that blood pressure controlled.
Advancing the issue of women's heart health requires a broad approach.
We need to include women more in studies so that we can really understand disparities and be able to address them. We also need to make sure our clinicians, doctors, nurses, understand that this bias exists and then that they have the tools and the training so that they can make sure they're removing this bias.
Women also need access to convenient, affordable care.
Women are the chief health officers of their home, and we often don't prioritize our own health because we are prioritizing everybody else's around us.
At CVS Health, we're eliminating those barriers to access. We actually have within our Minute clinics access to very simple health screenings and services specifically tailored for women.
We really have to help women access care when they need it, where they need it, through virtual care, through community-based retail clinics, through digital solutions if that's what they need.
Women can also take charge of their own heart health with a few simple steps.
The most important thing for women is understanding their family history, making sure they're getting all of the appropriate screenings, making sure they're going to their primary care providers regularly, and speaking up if they feel different or something's not right.
Advocate for yourself. Advocacy means knowing information yourself, being screened, and then learning about what these small modifications can be that can really deliver big dividends over the course of a life.